What would it take to produce a force where 95% of its members are ready for deployment at a moment's notice? Not just capable of going, but able to perform optimally when called upon. This is the question our innovation team set out to answer. But before we show you what we developed, let's define our enemy. Musculoskeletal conditions are the #1 reason for medical appointments, missed workdays, and profiles across the DoD. Compounding this is the fact that combined rates of active duty airmen who are overweight and obese has risen 60% in the last decade. Musculoskeletal problems continue to be a leading reason for medical retirement, resulting in the loss of valuable airmen. So again, we ask the question, what would it take to do this better? Learning from the work of our AFSOC and Guardian Angel communities and their associated POTFF efforts, what if we created an avenue for rapid evaluation and treatment sensitive to the operations of our units and their unique requirements in an evidence-based and high-touch way? The answer for the 31st Fighter Wing is something called COBRA, standing for the Comprehensive Operational Medicine for Battle Ready Airmen Clinic. COBRA establishes a hub-and-spoke model of care incorporating diagnosis, recovery, rehabilitation, and performance optimization into a single unified mission. Spokes are to be established in each of 5 different locations and intended to provide rapid, evidence-based treatment at or near the point of injury. Spokes are intended to minimize airmen's time away from their duties and create avenues of effective communication between line commanders and medical assets. Not every need or condition will be able to be adequately addressed in a spoke, at which point the hub becomes increasingly important. Each of the spokes can refer patients back to the hub to get immediate feedback from a musculoskeletal provider. The hub would provide capabilities such as musculoskeletal diagnostic ultrasound, injection modalities, and pain-relieving treatments like acupuncture and therapeutic dry needling. Importantly, any interventional procedure would be carried out in the hub to comply with medical standards. Patients can be treated and subsequently returned to their respective spoke with rehabilitation instructions and treatment recommendations. The hub will house unique rehab equipment such as gait retraining software, AlterG treadmills for rehab, recovery modalities, along with a float pod for sensory deprivation. It will resemble a high-level athletic training room with an end goal of performance optimization, not just recovery. Members will not need appointments and will be able to walk in to see their spoke providers. If a higher level of care is deemed necessary, the hub will also offer walk-in availability. Acceptable access to care is to be redefined as when it is least disruptive to the unit's mission and as soon as the patient can be available. COBRA requires an initial investment of adequately trained personnel to perform the requested tasks, specifically 11 medical positions including physical therapists, athletic trainers, and strength and conditioning specialists. This investment, however, will see a timely return in both saved man-hours and cost of care. Changing the paradigm of health and wellness of our force to achieve 95% is hard, but at the 31st Fighter Wing, hard things are what we do. So, will you join us?